Okay, in part 2 of Movements to Master for golfers, we are going to move down to the shoulder. And what we really want to do with the shoulder, somewhat similar to the neck, is assess the shoulder's ability to rotate as well as kind of separate away from the body. And the big thing here is we're going to assess both range of motion, but also stability and strength of the shoulder. So, the key is all these things you should be able to self-assess and perform on yourself. And so with this, you're either going to have a mirror, or sometimes because of the neck, if you're having neck issues and it's tough to look into a mirror, it may be beneficial to have somebody look at this for you. Okay. So really, with the shoulder, we're going to test both sides. Okay. And what you're going to do is you're going to line the elbow up in line with the shoulder. You're going to stand tall, and the first part of this is just with the elbow staying right in line with the shoulder, how far back can you rotate the forearm? And what you're doing is, if you're looking at a mirror or if somebody's watching this for you, you're looking at the forearms position relative to your spine. So you're either going to be short, in line, or beyond, which I don't think I can do very well. And that's just assessing your range of motion and upright posture. Then part 2 of it is you're going to assume a golf posture, kind of like you're at your address, and you're going to bring that elbow back up in line with the shoulder, and then try the exact same thing without coming out of that golf posture. Now, many individuals, this will get less in that second posture. Okay, so when you're in this kind of slightly trunk bend forward, it makes it more challenging for that shoulder blade and shoulder to get that shoulder back in the same position as it was when you were standing. Okay, so just for your information, if you can do very well here and your range of motion is fine, but now all of a sudden you get into this position, the golf posture, and it's drastically limited or it's painful, then you're probably looking at more of a strength and a stability issue in the shoulder blade or the shoulder versus just a range of motion issue. And there's a big difference between those two things. So the self-assessment would help you figure out what are the things you need to work on. If you can't do part 1, then you just have tightness and limitations in the shoulder and potentially pain. And then if you do that fine, but you go to part 2 and that's a challenge, then you're looking more at a strength or stability issue that you'd want to address. So a very simple way to assess is the shoulder where it needs to be for the golf swing, both from a range of motion standpoint and then also a strength and stability standpoint. And then you'd want to test both sides, okay? Big things we're looking for are pain. Can you get that forearm in line with or beyond the angle of your spine? And then does it change at all from when you're upright to in the golf posture? All right? Give it a shot. Keep an eye on it. Preseason, in-season, postseason. And if you're having issues, you know who to contact. Otherwise, plenty of resources on our website to help work on that shoulder mobility. Thanks for watching. Have a great day.